Hello, my name is Elizabeth, and this is what nursing means to me, why I chose the profession, and the commitment it requires. Traditionally, nursing has focused on caring for people who are sick, injured, vulnerable, or unable to take care of themselves. Nurses have long provided comfort, hygiene, nutrition, medication, emotional support, and assistance with healing. Today, nursing has developed into a high skilled and evidence based profession. I see nursing as both an art and a science. The science part of it involved understanding the human body, diseases, medication, lab results, clinical procedures, and the art part of nursing involves compassion, communication, patience, empathy, and seeing each patient as a whole person, regardless of their background or circumstances. So nurses, they don't just give medication or check vital signs, but they assess the patient, notice their condition, make clinical judgments, prevent complication, and also provide education with to the patient, and also communicate to the healthcare team. So for me, nurses spend much time with patients than than physician or other care teams like pharmacist or PT, you know. So they are able to recognize improvement or deterioration on a patient. Nurses serve many roles. We start by caregiver. The nurses support patients with activities of daily living, pain management, wound care, medication, emotional support. Nurses can also be an assessor and make clinical decision. They gather information from the physical assessment, vital sign, medical histories, and diagnostic tests, and identify the patient's most urgent needs. Nurses can also be advocates, where they protect the patient's right to safety, dignity, choices, and well-being. They listen to the concern, make sure the symptoms are taken in seriously. They help patients also know their treatment options, and also they are able to speak to those who cannot speak for themselves, the vulnerable. The nurses also teach and coordinate care. They educate the patients and families about their diagnosis, medication, disease prevention, lifestyle changing, and any warning signs they should watch out for. Nurses, I can say they also work as a team. They work with physician, pharmacists, nursing assistant, therapists, social workers, and case managers to promote care and continuous safety of our patients. So for me, nurses also involves caring for the whole person. The illness that can affect physical health, emotional relationships, independency, culture, financial, and spiritual well-being. So for these reasons, care must be individualized and respectful of each patient's need and background. This be it the way the culture, culture. My journey into developing my journey into nursing developed through caring for others and working as a CNA. This experience has taught me that small action can make major difference, helping, for example, just cleaning, making the patient feel clean and comfortable, protecting their privacy, listening to them when they are afraid, and offering them reassurance that it can restore dignity and hope. Nurses also offer career. Nurses also have many career pathways. We can work in hospital setups, schools, rehabilitation centers, home health care, public health, researcher, education, or even in administration. So, and in hospital setup, there are many nursing parts like med surg, ICU, emergency, but all these, they work together for the well-being of a patient. Becoming a nurse requires more serious academic and personal commitment. We study anatomy, pharmacology, health assessment, ethics, and we have also a lot of clinical rotation, simulation, and competency exams. So as nurses, we cannot only rely on memorization, we must understand the reasons behind these actions, think critically, recognize priorities, ask for help when needed, and continue learning through our careers. So for me, nursing represents service, responsibility, integrity, compassion, and lifelong growth. My goal is to become a nurse who provides safe, evidence-based, cultural sensitivity, compassionate care, and I want also my patients to feel respected, heard, and supported. So in conclusion, nursing combines knowledge, clinical judgment, advocacy, education, teamwork, service. Although the journey requires dedication, sacrifice, and discipline, it is also meaningful and rewarding. So I'm honored to be pursuing this profession and look forward to make positive difference in the lives of patients, families, and communities. Thank you.